Hey guys, I'm back again. This is really quick for me, I know, but I thought it was really important for me to make this video and update you on what's happened to me this week because it was actually quite scary at one point, and I don't want any of you to be freaking out the way that I was if this should happen to you. So basically, if you remember in my last video, I said that my gums were swollen up behind my front teeth, especially behind this one. Well, that, after I made that video, continued to get worse. It was Sunday when I filmed the video, and by Monday I was in chronic pain. And it was really worrying me because it was concentrated behind the one tooth. So I thought that perhaps with all of the pressure of my teeth being pushed back by the gap closers, that perhaps somehow that had damaged my front tooth and that the nerve was kicking off. It was hurting all the way up through the tooth and up into my face, all the way up to here. It was so bad that I was waking up in the night with pain and everything. It was terrible. So what I did was went to the orthodontist, like I told you in my last video, because my suspicion was that it was from the gap closers and the 8 ligature, all too much concentrated pressure in one place. So I went to him. He said he didn't think it had anything to do with that, but he would remove the 8 ligature for me anyway and put back on the individual little ligatures on each tooth just to relieve a bit of pressure, hoping that that would help things. He also gave me this, well, I say gave me, he recommended, I had to go and buy it at a pharmacy. It's oxygenated water. Basically, he said that because the gum was swollen now, so swollen at this point that you could only see about half of my tooth at the back, I needed to get in there and clean behind the flap of gum, so to speak. Because it was so swollen, obviously half the tooth is covered, therefore you can't actually brush that half of the tooth. Plus, by this stage, my gum was so sore that I couldn't even go near it with a toothbrush. So, obviously, bacteria and stuff can get up behind the gum then, with it being so low. So he gave me these little, I don't even know what they are, little fuzzy tip things. And he told me to dip these into this and then put this up behind the gum to clean it out. And what happens when you use this is that it foams up. So apparently the point is that it's supposed to foam up and push anything that shouldn't be there. It's supposed to push everything out, basically. What's really weird about what happened was that when the gum and the tooth were really sore without even touching them. They were pounding constantly, and I was always in pain, like I said, all the way up to here, big stabbing pain up the front of my face. And the gum was really sore to touch, and if I ever ate, I couldn't bite through anything. But when I was putting these little things up behind the gum to clean it, I didn't feel anything, and that was really, really weird. And at a couple of points during the week, while it was really swollen, I noticed a couple of grey areas on it, which afterwards fell off. I'm not sure why that was at those parts of the gum. It was mostly around the edge of it, the edge of the swelling. Maybe I was biting down on it or something a lot when I was eating, or maybe when I was sleeping I was doing it. So maybe that's why it just killed off the edge of the gum, but that was quite weird as well, obviously. I mean, the dentist told me not to worry about that because your gum regenerates really fast anyway, but obviously that's weird, when you realise that pieces of your gum are coming off. It's never nice. So I did this whole cleaning out thing like the orthodontist said for a good couple of days. I was taking lots of painkillers, anti-inflammatories, paracetamol, all of that kind of thing, but it wasn't really making that much of a difference. And like I said, I kept waking up in the middle of the night in such pain that, I would have to get up, take pills, wait for the pills to kick in, and then try and fall back to sleep. But even when the pills had killed the pain, there was still this terrible throbbing in my mouth all the time. By this stage as well, the swelling had spread from the back of the teeth to the front, and all along here, the gum on the inside had swollen up, so it made my lip look huge. It started off just on this side, and then eventually it spread across the whole front of my mouth, so my top lip was kind of massive. It looked like I'd had really bad Botox or something. And then, so once that happened, once the swelling went into my lip, then I got really worried, and I decided I would go to the dentist, even though the orthodontist had already told me that I needed to do this cleaning out thing. So when I went to the dentist, he was actually really shocked at how much swelling I had in my mouth, and he numbed it all up for me, and he cleaned it all out with antibacterial stuff, right up into the gum and everything, and he even cut off some of the swollen gum that was really low down the tooth, because he said, you know, obviously, like the orthodontist said, with it being that low, it can only make things worse because you can't clean up behind the gum and things. So he removed just a slither of the edge of the swelling for me, which actually relieved a lot of pressure, which is really weird. The whole thing was just really weird. So he told me to use this for a week. It basically just says that it's a professional mouthwash for plaque control, and it's supposedly an intense one, and it's to promote healthy gums, and yeah, basically that's what it is. This mouthwash stained my teeth, which was kind of gross. It made it look like I was a big coffee drinker, and my teeth, sort of like in between the teeth, went kind of yellowy browny, which was really not pleasant. But to be honest, I was willing to put up with it if this mouthwash was going to save me. So I used the mouthwash for a couple of days, and I didn't see any improvement. I mean, when I've got something wrong with me, I'm quite impatient as well. Like I want instant improvement. But by this stage, I was thinking that I probably had an infection of some kind because of all the swelling. Because the swelling actually kept on getting worse and worse for quite a while, and it was spreading, and it spread out into my cheek here. And this, when I smiled, though, it wasn't there. It was completely filled in. And here as well was really swollen. I was getting pain all the way up to my eye almost by the time I went to the doctor. It was all the way up to here, and it spread. The swelling spread out all the way around here. So this part of my face was really puffy and swollen, and it just was really uncomfortable as well. You know, like the pain in my face was just terrible. So after the dentist, when he gave me this mouthwash to use, I went to the pharmacy and I asked them if they could give me some really strong anti-inflammatories. So they gave me basically like a super ibuprofen. Those ones they said were really strong, and you could only take 3 a day maximum, so like 1 every 6 to 8 hours. And they were really good. They were actually brilliant. I suppose in the UK maybe they'd be the equivalent of like a Nurofen plus. I don't know. But they were really good. You did have to take them with food though, because they were extra strong. But yeah, they were really good, and they helped me with the pain a lot, but they didn't actually bring down the swelling much. Again, another indication to me that I had an infection, because if you're taking anti-inflammatories, it should be bringing down your swelling, and I'd been taking anti-inflammatories for a good 5 days at this point, and still no results. So when I went to the pharmacy, I also asked them for anything they could give me that would numb the area sort of directly. So I got this mouthwash. Excuse me, I have a bit of a rough throat at the moment. This stuff is pretty amazing. It completely numbs your mouth. It's really weird because it's a very strange sensation. But when you use this, within a couple of minutes, the entirety of your mouth goes numb. It doesn't last very long, but it gives you some immediate relief from any sort of surface pain, if you know what I mean. Like the tenderness of it would go away for a good maybe 10-15 minutes, and that gave me a chance to just sort of rest a bit while I'd be waiting for my pills to kick in. So at this point I'm using about 1 billion different products in my mouth, obviously, and also taking loads of pills. So I went to the doctor, and I asked her, you know, if she could shed any light on it, if I had an infection of any kind. She took a look at my face, obviously, at my mouth, at my nose, and she said that the inside of my nose was very swollen, which obviously isn't surprising considering all the swelling was basically around that area. So she said she thought it was a sinus infection, but she wasn't sure how that would have happened the way it did because it started in the gum. So, but anyway, she was pretty sure because of my swelling symptoms that it was a sinus infection. So she was treating it as if it was one. She gave me these really strong sort of double dose antibiotics, which I can only describe as magic pills, because by the next day I felt so much better. I started taking them as soon as I got them from the pharmacy that day when I went to see the doctor. And by the next morning even, I felt so much better. And I even slept through the night that night for the first time since this whole thing kicked off. So I think it was a sinus infection. Well, it was, basically. I went back to see the doctor yesterday, and she said that considering the reaction of my symptoms to the antibiotics that she gave me, it was definitely a sinus infection, but that somehow was triggered by my gum. And obviously, I mean, your sinuses and all the soft tissue around here is in very close proximity with these upper teeth, so I guess it was just a knock-on effect. But I mean, I didn't even know that was possible, that something that was wrong with your teeth could then cause a problem with your sinuses. But yeah, anyway, apparently that's what it was. So I wanted to let you guys know that that could happen in case any of you start having all of this swelling and pain and stuff, and because it was just really confusing for me when the dentist told me there was nothing wrong with my tooth. I forgot to say, but obviously he did x-rays and everything, considering how much that one tooth was hurting, and the tooth's perfectly healthy. There's nothing wrong with it. So when he said that, I was just so confused because I was convinced it was going to be, I was going to need a root canal or something like that because it was just so painful. Something really weird happened to my phone then, and I'm not sure if it's just recorded the last few minutes of my video. I think my memory's getting a little bit full, so I should probably take off a couple of videos. Anyway, that's just about it, and like I said, I just wanted to let you know that that's what had happened, so you don't worry if something similar happens to you. While I've got you though, I will just let you know about my updated tooth care routine. I decided, because I have been having little problems with a bit of gum swelling here and there, I decided to buy myself a water pick. My orthodontist had told me that there was no need really to buy one of these initially, but I'd heard so many great reviews about it that I decided to buy one. I bought the travel size one, so as you can see it's very small. I just thought it would be better to buy the smaller size, just storage, So this is how tiny it is. This obviously is what you attach the heads to. This is the little tank that you put the water in. It attaches this way. So basically these are the little heads that you get. There are a few different ones. This one's a tongue cleaner. This one's your standard sort of flossing head. This one is for sensitive teeth, I believe, and then this one, this one is your orthodontic one, because it has a brush head, so you can get in between all of the brackets, and it takes forever to use this and try and brush in between all the brackets, and it's really messy, but it is actually really good. And the reason I initially got this, like I said, was I got a bit of, I got some swollen gums along the bottom, but like barely anything. But like I said to you, I'm really, I suppose I'm a bit of a hypochondriac. Whenever I've got anything wrong with me or I see something different, I always sort of panic and I want to get rid of it straight away. So I bought that. I use it maybe twice a week. Like I said, it is actually quite messy. When you're going around your tooth with the flosser, it splashes all over the place. You have to definitely be over a big bowl or a sink to do it. But it is brilliant, and it makes your mouth feel so fresh afterwards and clean. So I've been using that. Water picks really are great, as you will have seen elsewhere on the internet. They are they're really good. All the reviews were right. They're fantastic. It was about €100 though, so I will warn you, they are expensive. The other thing I started doing was using this. Quite common, I'm sure most of you know. It's a mouthwash, you know, especially for gum issues. I just wanted to make sure that my gums were healthy, because especially down here on my front 4 teeth, it's quite difficult for me to clean around the brackets because the teeth are very small there. So I just wanted to make sure that the gums were getting the care that they needed, basically, because they had shown a bit of irritation. So I use this once a day. If you have severe gum problems, it says to use it about 3 to 4 times a day. But yeah, I use it once a day just because it's just something I like to do. And then the other thing I changed was I bought this super floss, which, as you can see here, is particularly good for people with braces. I had been flossing with just normal floss before, but I found that you know, it was really difficult to sort of post it down under the wire and get all in there, and it was getting on my nerves. So I bought this because it has this hardened end here. And this is the end that you can then like sort of post up. I'll show you how easy it is. That's how easy it is to pop it just behind your wire to be able to get in there. And it also has 2 textures. This is obviously just normal floss texture, and this is a sort of spongy part to it. I love this part because I feel like it really gets all up in there. It really is like brushing between your teeth, rather than just, you know, sliding this between. I don't know, I feel like this is more effective because it has more of a texture to it. This is really smooth, so I feel like it's not getting everything out from between your teeth. But yeah, anyway, I bought this and it's proven really, really good, so I thought I'd let you know about that. The dentist actually, when he did my professional clean a few weeks ago, used that on me, which is where I first saw it, and then I thought to myself that I would buy some. So I just got it from a pharmacy, and it's only a couple of pounds. It's not expensive. So I've shown you now my huge collection of mouth products. I'm much better now, by the way. Like I said, those antibiotics work the trick. I took them for about 4 days and I'm completely better now. All the swelling's gone down. The gum has stayed a little bit lower than it was before behind this front tooth, but the dentist said that if that doesn't you know, shrink back by the time my braces are off, we can always just trim it, you know, so that I'm still being able to clean the entirety of the back of my tooth. So yeah, another really, really long video. Sorry about that, but like I said, I had a lot to say. I felt like you needed to know this because it freaked me out. So there you go. I'm gonna go off to work now, and I hope you guys have a fantastic day. Let me know if you have any questions about all of that I just talked about, or if any of it didn't make any sense. Let me know, because I was kind of, you know, all over the place. I'm trying to keep the video to, you know, under 20 minutes. It's now 18 minutes. I'm so sorry. So anyway, I'm gonna go, and I will see you again soon after my next orthodontist appointment. You guys are awesome. Thanks for watching and subscribing. Bye.